Let's talk about skin necrosis in tummy tuck. Why does it happen and how do we treat it? Now, tummy tuck's an operation where we make a low incision and we lift up your abdominal wall off of the muscle layer. We pull everything down and remove the extra, which allows us to smooth out the abdomen and get rid of extra skin and tissue. Now, when you do a tummy tuck, you make a low incision from hip to hip. You elevate the abdominal wall off of the muscle layer, pull everything down, and remove the extra. That's how we tighten everything up. Now, the blood supply to that tissue comes up from the muscle wall, and you have to cut it in the process of elevating everything. So all of the tissue of the abdominal wall is living off of this alternate blood supply, right? So its major blood supply, its normal blood supply has been altered. And so it's more prone to have trouble healing. And unfortunately, you can even lose some of the skin, which is what necrosis is. The area of the abdominal wall that is farthest away from the blood supply on the sides is going to be the area in a triangle underneath your belly button. And some of us call this the triangle of doom. So the way to avoid necrosis in this area is, number one, be very gentle in your handling of the tissue. Don't pull things too tight. If you pull the abdomen too tight and you stretch those little tiny blood vessels, you can unfortunately cause them to kink and clog off. That's not a good thing. The other thing is that you want to avoid anything that potentially damages that blood supply. So that's why a lot of surgeons completely avoid liposuction of that abdominal tissue during a tummy tuck. Now, say your abdominal wall is thicker than you'd like and you would like to make it a little more thin. So what we do is we remove fatty tissue underneath Scarpa's layer. So Scarpa's layer is, you can think of it this way, there's two little pockets of fat and there is division between them. We want to stay below that and remove fatty tissue from that area and not too close to the skin, because we want to preserve the blood vessels that are left behind, keeping everything alive. Now, you can remove fat in that area in two different ways. You can either remove it directly by looking at it and then removing it with our tools we have in the operating room, or you can actually do it with liposuction, but you need to stay, of course, deep. Another population of patients that we see that has trouble with losing skin in tummy tucks are people, of course, with clotting disorders. So those little tiny blood vessels that are keeping everything alive, they're more likely to clot off if you have a clotting disorder. Now, say you've had a tummy tuck and you are concerned that you may have necrosis. How do you know? So the first sign with most patients is discoloration. So that little triangle underneath the belly button, it tends to look a little bruised or purple. So if you see purplish discoloration in that area, always an important thing to tell your surgeon. So it could just be normal bruising, but it might be something worse. So if we think there's a problem, there's a few things that we can do to improve blood flow. So the first thing is look for anything mechanical that can be impeding blood flow. And it's often the garment. So we want to make sure that whatever garment you're in is fitting properly and not preventing blood flow to the area. Often if we're concerned, we'll just get rid of the garment altogether. The next thing is that we're going to use topical medications that improve blood flow, either nitropase or DMSO. Those are the most common ones. And then often hyperbaric oxygen therapy to supercharge the blood that is getting to the area. And then it's just watchful waiting to see what happens. A majority of patients that have trouble initially, when all of those things are done, almost all of it or all of it recovers. Now, if it doesn't recover, then we will watch it for a week or two to see it resolve. It often looks like a larger area than it ends up being. Once we have figured out what area of tissue didn't make it, then we can remove it. And depending on how much is damaged, we can either close it, so you'll have a little vertical incision, or if the area is too big, you lost a lot of tissue, then we can do things to help heal the area faster, like a wound vac. And I know this is going to sound crazy, but often, even if you lose a decent area of tissue and have to heal with a wound vac, it often looks pretty good once we get you completely healed, and we can do some fancy footwork rotating tissue in to close the area. So that's kind of tummy tuck necrosis in 4 minutes and 15 seconds. Let me know if you have any more questions.